Now, along with testing, one of the best ways to prevent the spread of coronavirus is contact tracing. But how does that actually help us rebound from the virus? 5 on Your Side investigator Jonathan Walsh breaks down the process of tracking down people who've been in contact with those infected.
So here's how it works. It all starts with a lab result. Each lab has to, no matter where they are, immediately report a positive test to the Ohio Disease Reporting System. Then each individual county will start the contact tracing process.
Fever, chills, body aches, no taste.
Cindy King from Alliance tested positive. She got a call.
She said that I need you to stop what you're doing and go home and quarantine.
Tracers ask patients about pre-existing medical conditions, explain how to keep COVID from spreading in their homes, and ask where patients had been 14 days prior to being sick.
That's a way where we find out, oh, they were at a dinner or they went to a party, a wedding.
Ramona Brazil is from the Cuyahoga County Health Department. If the patient has traveled,
what airplane, did you get on? What was the flight number? Where did you sit? So it's really a lot of questions about that.
Questions trying to uncover as many people in the patient's previous paths.
Then we would ask for the names of everybody, so the names and phone numbers of people they were around in those 2 days prior to when they first started getting sick.
Ramona tells us the tracers focus on the close contacts. Now, those are people who were within 6 feet of the patient for 10 to 15 minutes.
So it may not end up being every person that was in a room, every person that was at a party.
She tells us getting a hold of the people on that list can be emotionally draining.
She asked me, when will I feel better? And I couldn't answer that for her.
Is there a need for more contact tracers?
Yes.
She tells us Cuyahoga County has about 60 tracers, but could use 120.
We're really seeing that, this need is there. This is a cornerstone of public health.
Well, we're closely monitoring the number of tracers that the locals have.
Joanne Pearsall is the deputy director of the Ohio Department of Health. She tells us 9,000 people have applied to be tracers. The state has hired 100 contact tracers so far to help the local health departments, with the intention of hiring at least 40 more.
No magic number, right? There are lots of estimates out there, the number of tracers that are needed per population.
When we call the contacts, you just get kind of a variety of responses. And so sometimes people hang up, sometimes people cuss us out.
Health leaders and past COVID-19 patients urge everyone who is contacted by the tracers to cooperate, give honest answers, and understand.
I think it's really important just to answer the call and become educated and to follow the guidance that's given.
We just want people to really be considerate of other folks as we all try and get through this.
This is not a joke. This is not, COVID-19 is not a joke. This is real.
I'm 5 on Your Side investigator Jonathan Walsh.